Welcome, listeners and viewers of your award-winning Let's Talk America with host Shana Thornton podcast radio show. We are super excited that you're on with us right now. And we always, of course, present the best and the brightest in terms of guests and also intriguing topics. And right now, this episode is no exception. I am so excited to have someone back on with us. His name is Dr. Matthew Budoff. He is an acclaimed cardiologist, and he's going to be talking about some interesting elements tonight. We're going to talk about some latest TikTok trends about garlic in your nose. You've probably heard of it. Does it really work? Does it protect your heart? We're going to get the expert, Dr. Budoff, to tell us if it's true or just all urban myth. And we're also going to talk about cholesterol, of course, the C word many of you don't want to talk about, and also hypertension or blood pressure and what it means, and if there's a genetic disposition that allows you to be more at risk. So we're going to talk about all that and more. But first, Dr. Budoff, we have a custom here on Let's Talk America Radio where we give our exclusive guests the opportunity in 2 minutes or less to talk about not so much the cardiology, the CV. I've seen it; it's quite impressive. But for you to say what really motivated you to come into this specialty of medicine? You could have chosen so many different areas. Why cardiology?
Well, cardiology is very high energy. You're having a heart attack or you're in heart failure, and we have great therapies to reverse it. It's truly a reversible disease, and it's so rewarding to see somebody who's so sick 1 minute, and an hour later they feel fine and they look much better and they have a good outcome. So a little different than cancer or lung disease, where it's more slow and steady, and unfortunately, it doesn't always result in a great outcome. We tend to, if we can get people, going early, we can really do a lot of good. And then there's also prevention. I mean, we can get people motivated to do the right things, diet, exercise, maybe take a certain medicine and live longer. So I find it very rewarding in those two aspects.
Yeah, such powerful points that you do bring up. Of course, all of the disease states matter, but what I continue to find is that cardiac disease or heart disease, rather, is so common and still in the United States, the leading cause of death. And we do tend to sometimes be afraid of other disease states when we hear the name, but heart disease should be taken just as serious. And that brings me to my very first question. And just a friendly reminder for everyone that's watching us, we do encourage you to share this episode as well. But Dr. Matthew Budoff is a professor of medicine, and he is at the School of Medicine at UCLA, and he is the endowed chair of preventive cardiology at Harbor UCLA Medical Center. So Dr. Budoff is certainly very qualified to answer any of the heart questions or cardiology questions that we have tonight. Doctor, my question is what I have always observed, okay, and it's two-part. I think one of the many reasons why people are not always alarmed at disease states related to the heart, if it's dyslipidemia or cholesterol, as we know, or blood pressure or hypertension, or even diabetes, that affects obviously the heart as well. It can, type 2 diabetes in particular. I think so many people see it as so common. Right. I mean, we all know multiple people in our lives that have cholesterol problems, blood pressure problems, type 2 diabetes, and it seems not to slow them down or stop them. And some of them will even say, I don't even take the medicine. I don't worry about what the cardiologist says. I'm good to go. So I think there is often an urban myth, if you will, of where people are not taking heart disease as serious. Because another point, is you so eloquently said and pointed out why you chose cardiology, I think it also has a very good way of hiding itself, right? I mean, because if we hear certain things as cancer or other disease states, sometimes it has a physical element to it where we say they look drastically different. But obviously, you and I can have high blood pressure and cholesterol, and there's nothing different about us. My question to you as an expert in this field of cardiology, of course, again, heart disease, the leading cause of death here in the United States. How do we encourage everyone, the masses, me, many other people like me, to understand just how serious heart disease is?
Yeah, well, if you just look back over the last year, I mean, we heard every day how many people died in our community of COVID or in our state or in the US. You triple that number. And that's how many people died of heart disease that same day. So when they talk about these statistics, it's literally last year, 3 times as many people died of heart disease as COVID. So it was the unbelievable missed opportunity of a lifetime to educate our population. We educated them on COVID because that was happening right now, but we missed the big picture. I mean, just imagine if CNN or whatever you'd like to watch said, oh, 1,700 deaths today from COVID, and by the way, 4,000 deaths from heart disease today, right? I mean, people would start taking this a little more seriously. I mean, you mentioned that everybody, people, we all know people have all of these diseases, but we probably also know somebody who dropped dead at age 50 or 60,
Right.
too young, from a heart attack. And that would have been preventable if we had just gotten a little serious, about our health, even just moderate. I'm not talking about becoming a marathon runner or, only eating certain vegetables. I'm just talking about moderate what you do a little bit, and you'll live longer and you can keep enjoying life.
Yeah. So key. And I think one of the important things is we remember the why, right? And the why is not always, no matter how much endorphins you get off running a 5K, the why is being around to have a future. And if that future is to be around for your kids, your nieces, your nephews, your grandkids, for you to walk across that stage to get your degree, whatever it is, it's a future that matters, and our bodies matter, and the heart is so important. We are going to get to the TikTok trend. We are, but such a great conversation starting off already with the one and only cardiologist, Dr. Matthew Budoff. You are watching Let's Talk America Radio, and we're interviewing asking some real life practical questions to this very qualified and respected cardiologist. I don't want us to miss this because I think so many times I've done so many health segments, enjoy being a health reporter, but I think sometimes people can look at news or information doctors bring and say, well, I hear you talking about the heart. I hear you talking, neurologists talking about the brain. I hear endocrinologists, talking about my pancreas and diabetes, but what does it all mean? Just how important is the organ called the heart? I mean, because I think sometimes we can take it for granted because we're like, well, we know someone that survived a heart attack and their heart stopped and they're just fine now and they got a pacemaker and they got a defibrillator, and it makes it seem like the organ is so strong and it can keep pushing. But just how vulnerable is this muscle, this important organ in our body?
Well, I mean, just to put it in perspective for some of your female patients, 10 times as many women every year die of heart attacks compared to breast cancer.
Wow.
So, not to say that we shouldn't be doing our mammograms and be on top of it, but 10 to 1, they die of a heart attack. So it's 10 times more important than breast cancer. And I don't know too many women who don't think breast cancer is important.
Yeah.
So I would say it's a pretty important organ because it's by far the #1 killer. And now it's killing more women than men.
Wow.
So we really have a lot of work to do. Again, a lot of it's easy, a lot of it's prevention, a lot of it's just slightly changing your style a little bit during the day, or maybe taking one extra pill.
Yeah.
But we know we can make you live longer if we get you on the right therapy.
Let's talk about the pill because look, you had many people, they're listening, they're engaged right now. But as soon as you said one more pill, you and I both know, Dr. Budoff, when people go to their physician, be it their cardiologist, endocrinologist, or primary care or internist, family practitioner, when they brought out the pad, the infamous pad, and send it in electronically to whatever favorite close by pharmacy, people tend to go, I don't want to be on medicine, Dr. Budoff. I'm already on 3 pills. I don't want to be on a 4th one. It's making them emotionally sicker. I've heard people in the community tell me that. They're like, it makes me feel like I'm not trying, I'm not doing my best. Talk about the therapies. And really, one of the connections I like to recognize, and not saying a diet and exercise, you're a cardiologist, you will push that, I'm sure, all day, every day. But one of the many reasons why, as human beings, we are living longer is because of preventive therapies, such as medications that is changing the course of action for so many people. Is that fair to say?
Absolutely, absolutely. We have some medicines now, and a lot of them are easy once a day medicines. There's new therapies coming out that are once every 6-month injections, if you prefer, to lower your cholesterol. Blood pressure and cholesterol are two of the most common risk factors. And, high blood pressure causes strokes. We called it the silent killer because, as you pointed out earlier, a lot of these people didn't feel bad. They feel fine, but
Right.
their blood pressure is ravaging their body. And then they have a stroke or they have a heart attack, and they're done for. And it's so unfortunate because they felt great one minute, and now their life is ruined. At least their quality of life is ruined
Correct.
because we didn't get that under control. So I think we can do a lot of it naturally. I'm not always pushing pills. There's diet and exercise, salt restriction. We talked about garlic a little bit. It does work if you swallow it, not put it up your nose, but we have great studies with aged garlic extract that shows that it'll lower your blood pressure and help your cholesterol. So if you're really against taking some of the prescription therapies, there are some natural ways of also getting at this problem. But you got to remember, if it's not getting the job done, you got to go to the real, the prescription treatments. Sometimes, not everybody.
Yeah, I want to talk about that. When you say the prescription, sometimes you have to do what you have to do because sometimes, and you know this as a cardiologist, that people can get frustrated. They're like, "Well, I lowered the calories that I was eating. I wasn't eating something high in sodium. I watched the cholesterol." Talk to us about that connection of genetics. It's the unfair thing that allows me to have the smile like dad, but it's also probably very likely that I may be picking up cholesterol or blood pressure, that dynamic of having hypertension, right? I mean, how real is that? Because I think a lot of times in the conversation, people put a lot of emphasis on diet and exercise. And you're a preventive cardiologist, you will push that again all day, every day, I'm sure. But isn't it fair to say that I can be a straight vegan and not replace it with carbs and chips? Because there are a lot of type 2 diabetic new vegans that have come on the market. But I'm saying ideally doing it a very restrictive way. They can give up meat, they can give up food, processed foods that have these cholesterol and high sodium, and still go to the doctor, and the doctor say, you have dyslipidemia and it's a really bad case of it. Isn't that possible? And if it's a mysterious way, it's likely from mom or dad.
Absolutely. Almost always, it's genetic when it's that high. We even call it familial hypercholesterolemia because it's in the family. And the liver makes 85% of your cholesterol. So if you wiped out all of the cholesterol you ever ate, you never ate an egg again, you ate perfectly, your cholesterol could still be very high. If it was 300 and
I,
you take away diet, it could still be 270,
I,
or 250, which is still way too high. So it is genetic, but a lot of it, and those are the extreme cases, but a lot of it's also just a genetic predisposition. For example, diabetes. My dad had type 2 diabetes. If I gain weight, for sure, I have like an 85% chance just from my genetics of developing type 2 diabetes. But if I can stay thinner and exercise a little bit, I'll never develop diabetes.
I,
So you have a genetic predisposition,
I
but
see.
it doesn't always have to work out that way if you can take care of yourself. And again, I'm not writing a prescription every day for every patient. I don't want to add to their pill burden and their copays. Sometimes we do need that medicine. If your liver's making too much cholesterol, you're going to need to turn it down probably with a statin at some point in your life, or else you're going to build up heart disease and unfortunately one day need a stent, a bypass, or even have a heart attack.
Talk to us about that. And I want you to also explain hypertension and blood pressure and its negative effect on the heart. But you talked about cholesterol. People here, they're like, well, my doctor's telling me my LDL is too high. He's saying my HDL is really low. And also when you explain the negative side of too much cholesterol, what exactly does it do to the arteries? And talk to us about how women, I've heard this and verify this for me, as women age, as they creep up and lose the estrogen or go towards menopause, that a lot of times, is it true that the protection sometimes it comes from the HDL that sort of diminishes or goes away? Talk to us about, is there a connection also between higher cholesterol and women going through menopause?
Yeah, absolutely. So the good cholesterol, the HDL, is kind of like a garbage truck. It goes around, picks up all the bad cholesterol, it takes it out of the plaque and brings it back to the liver for disposal. And then your liver just, chops it up and gets rid of it. So if you don't have enough of that HDL, men tend to run lower levels than women. they get heart disease earlier. Women start to lose that protection once their natural estrogens go away after menopause, and they start to build up plaque more. And unfortunately, that's just kind of the natural history of this, is that this bad cholesterol, LDL, likes to get into the blood vessel wall and kind of cause plaques and buildup. Imagine a pipe filled with all the gunk, and HDL is kind of the roto-rooter trying to get rid of it piece by piece. If you don't have enough garbage trucks, garbage builds up too much, and you end up with blockages that can cause a heart attack or a stroke. They're both, stroke is to the brain and heart attack is in the heart, and they're similar things. They just affect different organs.
And so I think so many times when we hear cholesterol, we're thinking, well, it's clogging our arteries and heart attack. But I want to make sure I'm right. You're also saying that high cholesterol can be a risk factor for strokes?
Yeah, I know. It's anything that causes atherosclerosis. So the same risk factors for the brain could happen in the heart. Now, blood pressure affects the brain more than the heart, and
Okay.
cholesterol affects the heart more than the brain, but there's a lot of crossover there. Yeah, I mean, I do a lot of scans of the heart. We call it a heart scan to see if people who, because you can't make an asymptomatic person feel better. We talked about we can make them feel worse by
Yes.
having to take pills, but they don't feel better by taking their cholesterol pill or their blood pressure pill. So I do these heart scans and I look into the heart with a CAT scan and see if there's plaque. And that usually motivates them because now they say, oh, I do have something to treat. I have blockages starting to build up. We do the same thing in the neck. And sometimes we see just from high cholesterol, plaques building up in the arteries to the head and neck as well. So, it's the whole body is blood vessels, and some of the things can overlap.
Yeah. Wow. And it's so real. And you did say, of course, cholesterol tends to affect the heart more, but it can cross over to the brain and cause a stroke. Let's talk about blood pressure. I know you just touched on it. So many Americans, millions of Americans and individuals around the world have hypertension. They have been told. And and I know that many people have been told when they go to a routine checkup or maybe a workman's comp case in their mid-20s, there's someone that says, maybe a nurse aide says, oh, your blood pressure is high, or the primary physician mentions it. They maybe they write a prescription, they don't follow up with it, and it's 10, 15 years later they're still saying it. How critical is it to address hypertension? And not always, like you said, with medication. That's not what we're preaching and pushing, but sometimes it is necessary and you have to do what you need to do to live and have a quality of life. But how critical is it in terms of blood pressure, what it does to the body and the brain? Because I know you said it affects the brain. Tell us what it does and what that pressure is doing. Because I don't think many people realize it. They hear blood pressure and they say, well, my papa had it, my dad had it. It's no big deal. Everybody has it. But how serious is it and how much does it tear up the body?
Yeah, so just think of a hose. So if you had a hose and you were aiming it at something and it was on just a little bit and a little water's trickling out, it's not going to do any damage to whatever you're aiming it at. But you crank up that hose and it shoots out with much higher force. Now it starts to do damage. And imagine in the blood vessels getting that higher force every heartbeat. So instead of getting 120 millimeters of pressure, it's getting 180 millimeters of pressure. And it's not just the one beat, it's a one beat every second for your whole life. So it's beating it and beating it and beating it, and it's punching harder and harder and harder until the blood vessel wall says that enough is enough, and it starts to build up thickness to try to compensate and fight back. And then the thickness blocks off the arteries or it bursts a blood vessel in the brain. And we end up with a catastrophic event. So we call it the silent killer
Yeah.
because you don't feel bad usually if your blood pressure is high. And that's why we've tried to institute screenings everywhere.
Yeah.
They've had even, barbershop screenings to try to get at some
Smart.
people who are, not inclined to go see their doctor, but like to hang out at the barber,
Yeah.
on a Saturday or a Sunday. And CVS and drugstores have blood pressure machines now. Fire stations, a lot of fire stations will do
Right.
free blood pressure checks. We're trying to get it out there so people know they have a problem. And you're right, it's not always a pill. It could be salt restriction. It could be a little bit of potassium supplement. It could be a little bit of exercise or weight loss, and that'll go away. Blood pressure can go away if you treat yourself right and can lose a little weight and eat better. Some
Awesome.
people it won't, but a lot of
Yeah.
people can keep it under control with just lifestyle.
Yeah, so key. We touched on type 2 diabetes earlier. I mentioned it at the top of this segment. And I have heard pediatricians, I'm a mother, and they have said that there has been an increase of type 2 diabetes among adolescents and children in the last 5 to 7 years. And so that makes me think, well, type 2 diabetes is on the rise, and maybe they're screening better. I'm sure there are lots of different dynamics to it. And I noticed that in a lot of pediatrician offices now, you're starting to see the nurse's aide check blood pressure in children. And for me, that's something new to see in the last 2 or 3 years, because when I was coming up, and I'm sure when you were coming up, we didn't necessarily go to the pediatrician, have blood pressure checked. Um, is it now common, or is more advice or guidance being provided to cardiologists and trickling down to pediatricians and family practitioners to now have a gauge of what blood pressure may be in children, adolescents? Is that something new? Are we making a connection that perhaps that can impact their health long term?
Yeah, we're starting to think now of what's called lifetime risk. We used to always think about what's going to happen in the next 5 years or 10 years, but now we're starting to think about lifetime risk. And if as a child, your blood pressure trends a little bit higher, it's not going to be super high, but it'll be
Yes.
high for your age. If your cholesterol is a little bit too high when you're young, if you have blood sugar for diabetes is a little bit high when you're young, that kind of gives us the insight that it's probably going to keep creeping up. And we don't want it to go 20 years until you see a doctor again and then come in with full-blown diabetes or full-blown, heart failure because your blood pressure was out of control. So it's just kind of to get some insight into where you are at one point in time, so we can kind of follow you over your lifetime.
Yeah. One of the things, and it's Real Talk for Real People, you're watching Let's Talk America Radio. One of the things I do know about hypertension, that's why it's so important to visit the ophthalmologist or optometrist, because they say when they look in the back of the eyes, often they're indicators for other things going on, blood pressure, perhaps. When it comes to hypertension, I do know when it comes to erectile dysfunction for men, some of that can be associated, if am I right, with high blood pressure that may have gone undiagnosed.
Absolutely. Yeah, absolutely. There's a lot of these diseases, unfortunately, you feel pretty good until it really starts to get advanced. Cholesterol, blood pressure, even diabetes. People have diabetes for many years before we pick it up if we're not looking for it. So a lot of these things, can cause a lot of damage if we don't kind of keep an eye out.
Correct. Oh, it's so important to keep an eye out. Before we leave, we have to touch on this new TikTok trend that was going on about garlic in your nose. Sounds absurd to me, but that's me. But any truth to any of this? Does it help you long term? I would imagine it's couldn't. I'd imagine it will allow your sinus cavity to just flare. But help us out. You're a cardiologist.
Yeah, so
Why are people?
garlic is pretty noxious. It's pretty, and as you smell it, it probably is not great. It upsets a lot of people's stomach linings. Your nose is much more sensitive than your stomach. Your stomach's made to eat all these spicy foods and has all that acid. Your nose doesn't have all that protection. So it's probably more like the ice bucket challenge, where it's something that's noxious and more harmful,
Yeah.
but people do it just to say, "Oh, I was able to do that. I was able to shove garlic up my nose." I mean, it probably helps a tiny bit with sinuses, but it probably does some damage to the lining of the nose. I've done
Yeah.
a lot of research with garlic supplements because I have a lot of patients who are reluctant to take traditional pills and go to
Yes.
the pharmacy. And we've studied this aged garlic, and it's odorless, and it lowers blood pressure, it lowers cholesterol, it helps your overall health, but you got to swallow the pill, not shove it up your
Yeah.
nose.
You've, you've got to do it. Seems much more less invasive to me to do it that way, but hey, who
Yeah,
am I? So you obviously are a fan of garlic. Let me ask you before you leave us, sir, as a cardiologist, what about fish oil? I've heard it's been great for many years. Do you support individuals taking fish oil?
absolutely. We don't eat a lot of fish. We should eat a lot. The recommendation is twice a week. Most Americans eat like way less than once a week. They'll have fish, and they walk down the fish aisle and they just kind of keep moving, or they don't know how to cook it, so they don't want to risk it, or it could go bad, and you don't want to take that chance. It's easier to cook chicken or meat or something else. But fish is great for you, and since we don't eat a lot, unlike Japan or other countries that eat a lot of fish oil supplements is probably very helpful. I like the higher levels of that EPA. There's EPA and DHA. EPA is probably better for the heart.
Okay.
So look at what you buy. Talk to your doctor. Doctors should be pretty familiar with fish oils now. We have a lot of great studies to
Okay.
support it.
Nice. That is so, so key. Before you get out of here, I know you mentioned diet and exercise. For those who are like, they put on the, freshman 15, but now it's the pandemic 20 or 25. I recently read that Americans have packed on the pounds
Yeah.
during quarantine in the last 2 years with the pandemic. What would be your advice for someone? I mean, a lot of it has to do with discipline, doctor. You know that better than any of us as a cardiologist. I once knew a cardiologist that would say, individuals would say, I'm going to do it with diet and exercise. And he said, well, that's what we tried for the first 50 years. It didn't work.
No,
But
I'm a fan of trying diet and exercise and then supplementing it as needed. I call it gaining the COVID-19. So you gain 19 pounds
yes,
during the pandemic, and a lot of people did, as you mentioned. So I think it's critical to keep in mind that you can start small. Just walk a little bit. Maybe if you're going up to the second floor, take the steps instead of the elevator, just
okay,
up one flight. And it's additive. It's optimal to try to do 30 minutes at a time, at least 3 days a week.
okay,
But it could be walking. It could be, going for a nice walk with your dog or with your significant other, or just taking a little mental break at lunchtime, going for a walk, getting out of the office, just to clear your head. And that'll help your heart, that'll help your bones, and that'll help your brain. Your
yeah,
brain does well with exercise. So start small, try to get up to 30 minutes 3 times a week.
yeah.
You'll feel better, you'll lose weight, and you get this endorphin high from exercising. You'll actually sleep better as well. So it really could be a win-win if you can actually get over the hump and start to do something.
Yeah, that is so true. At least do something to
Yeah.
do our part to care. And we, of course, go to great physicians like you to give us advice. But at the end of the day, it's our health. And it falls down to us, and also trying to be as compliant as possible. Such an honor to speak with you as always, Dr. Budoff. Thank you for all of the great information. I want to give you the opportunity for the next few seconds. If there was one single thing Americans can do to lower their chance of heart disease, because my risk of heart disease may be drastically different from yours, but what would be the one thing you would advise the average American to do?
So just go see your doctor now that the pandemic's ending. Just get a checkup, know your numbers. The three numbers you need to know. You need to know your blood pressure, you need to know your cholesterol values, and you need to know your blood sugar, because that's diabetes. You
Okay.
know those three numbers, the doctor can help you. And again, it could be very lifestyle oriented. It doesn't have to be medicine. It could be supplements,
Yes.
like we talked about, garlic or fish oil. And sometimes you might need a pill, but you'll live longer, and that's probably worth swallowing a pill once a day to have another year, 2, 5 years with your family, with your grandchildren. So just know your numbers, find out what they are now. They changed from 5 years ago when the last time you saw your doctor. They're going to be a little bit worse. The warranty runs out at age 50, and things start falling apart in our bodies. And we just got to start dealing with it. We got to address those problems head on. Again, it's for the greater good and for your own. You'll feel better.
Yeah.
Your life will be better.
I love it. And I think you acknowledge something that no matter necessarily how much we try to be the discipline or other things, with age, our risk factors grow up, right? I mean, that's just life. So maybe 20 years ago, we had our no cholesterol, everything was great. But as we age, it's fair to say we're more at risk, right?
Absolutely. We every year, unfortunately, you get a little older, your arteries get a little stiffer, your blood pressure will creep up, your cholesterol will creep up, your sugar will creep up. It's inevitable. And people are like, oh, I can't do the same exercise I used to do. And I'm like, well, that's why we don't see 80-year-olds playing in the NBA, right? Because our bodies just can't, as great as some of these athletes are, they lose an edge as they get older. We're aging, but we can do it better than just, sitting back and ignoring it.
Yeah, so true. Don't ignore it. And we have a long, prosperous life, great quality of health. Dr. Budoff, thank you so much for joining us here on Let's Talk America Radio. Where can our viewers and listeners go for additional information if they want to reach out to you or learn more about their heart and the risk factors that exist?
Yeah, so American Heart Association, the heart.org is a wonderful general location. It's well vetted. It's moderate. It's good lifestyle activities, and it's written by patients and physicians. So it's not just doctors dictating to you what to do. If you want to find out more about the heart scan or some of the research I've done, it's calciumscan.com, all one word, calciumscan.com. And, if you email, I'll be glad to try to get back in touch.
Awesome. Thank you, Dr. Budoff, for joining us here on Let's Talk America Radio. To all of our listeners and viewers, stay tuned in. We will continue to offer the best and the brightest. Stay informed because you deserve it. For more information, please visit ltaradio.com. Again, that's ltaradio.com. Stay safe, everyone, and we'll be back on soon.